Well, hello and good morning. Dr. Sil here, junior doctor from Australia working in mental health. And I thought today I would share a technique that I learned about ages ago. Haven't really been using much clinical practice, but used it the other day and it was helpful. And it's a good technique. And I've spoken to a couple of people since who use it and thought I'd share it. And you might have already heard about it. It's the 5-4-3-2-1 technique to help dissociation, to help with when you're feeling disconnected from reality. So I guess we can have a quick chat about trauma and dissociative responses, and then talk a bit about grounding, reintegration, and techniques around that. So if you're new here, welcome. As a quick disclaimer, all these videos are made in a personal capacity. There's no personal medical advice. It's all general advice, and there's no patient-doctor relationship formed, and I don't represent any institution or medical college or workplace. So with that out of the way, let's talk a little bit about trauma and dissociation. So when there is a stressor, an acute stressor, often it can trigger a fight or flight response, right? There's a part of the brain called the amygdala. It's connected to lots of other parts of the brain, and it can trigger a lot of things, including increases in hormonal levels in your body, like cortisol and adrenaline, and can make your heart rate go up. It can move blood around, so it can take blood out of your digestive tract and put it into your muscles, which makes you ready to either fight or flight. And so it gets you all kind of ready to engage. And it's a biological, evolutionary, historical phenomenon, so that when you are getting attacked or chased by a dangerous predator, you had all the blood in the right place and all your motivations in the right place, either to fight or to flight. So if you're getting chased, the classic example is that you see a saber-toothed tiger and you want to run out of there. So you get the amygdala shooting off all these instructions, and the body follows, and it's very quick. It's like that. And so right now, as I'm talking to you, if a snake just appeared right here, I would get a fight or flight response, and I would probably not fight. I would get out of here. Now, children, toddlers and babies and things, can't really fight or flight. And so it's kind of conceptualized that they develop a freeze response. Now, it can happen at any age, but this is kind of one way that it manifests is that instead of fighting or flighting, they freeze. And part of that freeze response is an internal. It's kind of a flight internally. It's a dissociation from reality. And that's a very protective thing for a child who's going through a traumatic experience, right? It protects them from whatever trauma. So let's not go into examples of trauma because that's not necessarily helpful, but picture a kid going through a very difficult situation. They can't do much about it. Well, they can't escape physically, so they escape mentally, and they dissociate from the bodies, and they can often I've heard people describe seeing it from a third point of, like, a different perspective, from a top-down lens, from a different point of view, or that it felt like a dream or a video game or something like that. And that's the dissociative mechanism occurring, so that the child is protected from feeling the reality of such a horrible event. So, very adaptive and helpful when a child's experiencing it, can become unhelpful later in life when you're just going to the post office and then you become dissociated and can't engage normally with the world, and it can become distressing, and anyway, it can become unhelpful is my point. So it's important to learn how to address it and how to deal with it and how to reintegrate a bit. And that's what grounding techniques are all about. And there's lots of them. I mean, it's worth Googling and seeing what works for you or the person you care for, or whoever you're watching this video for. But this video is kind of about the 5-4-3-2-1 method. I often used to just kind of pass a ball or an object with a patient and just kind of pass the object back and forth and make them focus on catching and looking and really trying to understand that the whole goal of grounding and a lot of trauma therapies is coming back into your body, okay? And just showing you that the body is a safe space. Come back into your body, the here and now, the moment that we're both in, connected. Come back here. And so whatever method works for you, do it, okay? This video is just talking about the 5-4-3-2-1 method. And it's great. So, it's never 100% in mental health, but it's worked pretty well a couple of times. So, in terms of what it is, it's essentially using the five commonly known senses of vision, hearing, smelling, tasting, and touch, and using those senses in a kind of as a tool to come back into the body. So the five is note five things you can see. And so let's do it together, right? So I can see my cavoodle mug. I can even touch it actually, but that's cheating. I'm just meant to be seeing it at the moment. I can see that. I can see the monitor of my laptop connected to my laptop, which you can't see, I'm realizing, but just trust me. Outside of the screen, just here is a monitor screen. I can see my microphone. I can see the, this is called a Saint-Hubert. I guess you'd call it a set of shelves or something. It's a French kind of furniture thing. I can see the Dr. Sill sign. That's 1, 2, 3, 4, 5. So that's 5 things I can see. And really, I guess I'm not doing a very good demonstration because really the goal is to look and appreciate the textures, the details, the depth, the contours, really looking, engaging with the photons and really deeply connecting there. And then that's 5 things you can see. Then it's 4 things you can feel, right? So I've got a lot of clothes on because it's cold, but I've got a denim jacket, so I can feel the rough canvas of the denim. I can feel the desk, which it's kind of, I don't really know what material that is, kind of like a MDF wood, not a great desk, but it holds things. That feels kind of cheap and yucky, and that's fine because it's bringing me into my touch. That's 2. I can feel the metal of this tray that holds my microphone and audio setup. And that's cold and smooth and contoured, and I'm trying to find descriptive words that's connecting to how I feel things. I can feel my own skin, or this. If you're with your partner, you can hold their hand, and you can feel the kind of soft or not so soft textures of the skin. And I think that was 4, right? It was desk, metal, skin, canvas. 4. Excellent. So now it's 3. So we've gone 5, 4, 3, and 3 is what can you hear? So let's just take a second. So I can hear the soft fan of my light source, my key light, which has a fan to keep it cool so it can continuously light me. I can hear the early birds starting to tweet. It's 5:58 a.m. in the morning, so the birds are waking up and the sun's starting to poke its head out. Yes, I film in the mornings because I'm a morning person. Hopefully you can't tell that it's the middle of the morning and I'm not too disheveled. But that's really nice. I can hear the blackbirds starting to sing. And I just heard a car go by. I don't think this microphone would have picked up on it, but there's a road that's not too far from my house. I just heard a car go by. So taking that second to connect to the space around me is a reintegrating kind of process. That's really good. Now, for smell. This one I'm not so good at. So now we need to note 2 things we can smell. Okay, I've got 1, which is, must look a little bit strange, but my microphone does have a bit of a smell to it. It smells like the kind of, it's kind of like a new car smell. That kind of plasticky, it's like a foamy plasticky smell. It's very faint. Oh, this is cheating. There we go. I found my smell that reintegrates me. It's coffee. Yeah, that's a nice coffee smell. And I'm going to cheat again. So the 1 is what can we taste? So I actually have a pretty bad taste in my mouth, which is, I guess, what happens when you're drinking a coffee. But I can taste the coffee. And it's not just, it's really trying to go in depth into the tongue, into the experience. Because when you think about what taste is, it's this transient, unattainable experience. Like, what is happening? It's so difficult to kind of formulate what taste is. If you think about it, it gets very weird. But engaging in that experience is what can bring you back into your mouth, and then by extension into your head, and then by extension into your body. And it's all about that regrounding stuff. So try this technique out. And here's the exercise. In the comment section below, I want you to do this exercise, 5, 4, 3, 2, 1, and write out 5 things you saw, 4 things you touched, 3 things you heard, 2 things you smelt, 1 thing you tasted. Cool? Put it in the comments down below. I'm keen to hear what you guys found. And then the second part of your comment, I'd love you to share some more grounding strategies that you or someone you know have used that helps. And I'll try them out with patients and with myself and with people, and see how they go, and I might make a video about that too. Cool? All right. Good stuff today, everyone. I wish you all a beautiful day, and I'll see you all in the next video. Bye for now.